Yeah, if you come over here, it'd be great. Come on in, Cam and Steve. Yeah. Some of you come over to the other side too. Yeah, we'll spread out a little bit here to appropriately, but thank you for joining me today, and we're very honored to have Deputy Secretary Eric Hargan here in Little Rock. Secretary Hargan hails from Pulaski County, but it is in Pulaski County, Illinois, and we're glad to have him in the sister county here. But seriously, we had an incredibly good meeting preceding this, in which we had a roundtable discussion on really the needs of rural health here in Arkansas. And I'm also glad to be joined, of course, by those that participated in that. And of course, Dr. Cam Patterson, Chancellor at the University of Arkansas Medical Sciences, Larry Shackelford, President of Washington Regional Medical Center, has joined us. Pearl McElfish, Project Director of the University of Arkansas Systems. Alan Finley, Administrator of Dardanelle Regional. Stephen Collier, Project Director of RCare. Chris Caldwell, Federal Co-Chair of Delta Regional Authority. Naomi Sweeney, State Office of Rural Health, Coordinator for the Arkansas Department of Health. Clint O'Neill, Arkansas DRA designee and representative. So we're glad to have all of them to join us today, and we're going to have a very exciting announcement that when I turn the microphone over to Secretary Hargan. And let me say, as a further word of introduction, that he has an incredible interest and appreciation for rural health because it's a family tradition for him. His great-great-great-grandfather was a doctor in rural Pulaski County in Illinois who traveled by horse and buggy and rowboat to visit his patients. And so that became a part of the family appreciation for rural health care. His mother worked as an X-ray technician in the same rural hospital for nearly 60 years. In our conversation, it was clear that Secretary Hargan has a passion for rural health, and the announcement that he's going to make will be very beneficial here in Arkansas to help us support the rural health needs of our state. And so with that, again, I want to thank Secretary Hargan for his friendship to Arkansas. He's been very responsive every time I pick up the phone and call him. We've talked about a lot of tough issues from COVID and testing to rural health. But today, he brings some good news to us, and I'll turn the microphone over to him. And then Steve Collier is going to have comments as an award recipient, and then we'll turn it over to questions.
Okay. Thank you, Governor. Thank you. Yep, and thank you, Governor. Good morning, everyone, and thank you for joining us here today. And thank you in particular, again, to Governor Hutchinson for welcoming us here today and being a very strong partner with HHS in working to improve the health and well-being of Arkansans. I'm here today to talk about the important work being done in Arkansas to combat COVID-19 and to improve the quality of health care delivered, especially in rural areas. As the Governor pointed out, rural health care is an important issue for me personally. Somebody who grew up in rural southern Illinois, the very tip of southern Illinois, where actually our basketball team played against Jonesboro, Arkansas, occasionally. And as pointed out, I have 5 generations deep in rural health care in my family, including to this day, about half my family still works in rural health care. It's an issue of paramount importance for President Trump and for this administration, where we have put a strong focus on rural health and health care like I think no president has done before. Earlier this month, you may have seen that the President signed an executive order, a welcome executive order, directing HHS to take a number of actions to improve rural health care and to broaden access to health care for all Americans by making permanent some of the expansions of telehealth that we have seen undertaken during this pandemic. Today, I'm pleased to be here to announce another set of actions taken in response to that executive order. The announcement of more than $35 million in grants from the Health Resources and Services Administration, or HRSA, at HHS to more than 50 organizations across 33 states, including a number of entities here in Arkansas that I will mention in a moment. And these new grants recognize the breadth of work we need to undertake in order to transform rural healthcare. They include, among other things, funding for training healthcare providers to deliver emergency care consults via telehealth, to create telementoring learning programs for primary care providers, to support telehealth-focused rural health research, to strengthen the healthcare workforce in family medicine, internal medicine, and psychiatry, to provide specialized technical assistance to 21 hospitals served by the Delta Regional Authority, to provide HIV care and treatment in the 7 states with the heaviest rural HIV burden, and to fund research at universities on problems faced by rural communities and ways we might improve healthcare access and population health. Now, many of these efforts have come out of work that we've done as part of a rural health task force that we've assembled of experts across HHS. Now I want to mention and congratulate those entities from Arkansas that are being awarded grants today. First, we're awarding $300,000 to RCare in Augusta as part of the Emergency Care Telehealth Program, with the goal of expanding access to providers and specialists for addressing critical first responder challenges, providing training and education on trauma and emergency situations that often occur in the most remote rural settings. Second, we are awarding $100,000 to RCare to support their Arkansas Rural HIV/AIDS Planning Coalition, with the goal of developing a regional approach to strengthening the healthcare infrastructure and alleviating burdens to HIV/AIDS care in southeast Arkansas. That includes activities like completing a community health needs assessment, hosting peer support groups that focus on PrEP and other prevention strategies, evaluating the current level of trained providers able to diagnose HIV, and identifying available resources for current testing sites. This activity is part of our work to address the challenge of rural HIV, in particular, as part of the President's initiative to end the HIV epidemic by 2030. Third, we're awarding about $750,000 to Dardanelle Regional Medical System in partnership with Conway Regional Medical Center to develop an accredited family medicine rural training track to help attract and retain physicians in rural Yell and Johnson counties. The goal is to welcome a new class of residents for this program by July 2023. Fourth and finally, we're awarding about $750,000 to the University of Arkansas's Medical School to work with healthcare provider partners to develop a similar training track for family medicine residents. And we also expect this program to begin welcoming residents by the summer of 2023. That's just 4 awards I've described, and yet I think it gives you a sense of the kind of comprehensive approach we've taken to rural healthcare, recognizing that we need to tackle everything from workforce development to particular disease challenges like HIV, to transforming care delivery with innovative technology like telehealth. We have a lot of work ahead for us to do on improving rural healthcare, and I look forward to working in partnership with and alongside Arkansans like those we're awarding grants to today. So thank you, everyone, for your interest in promoting rural healthcare and these pressing health issues that we are working to alleviate today. Thank you. Governor?
Thank you, Secretary Hargan. And with that, one of the recipients is RCare, who's a great leader in rural health care in Arkansas. Stephen, would you make a comment?
Thank you. Thank you. Needless to say, this is quite an honor and sorely needed. I'd like to thank the governor for his support and the opportunity to be here. Deputy Secretary Hargan, also thank you. And HRSA, which we work with HRSA all the time. At RCare, one of our slogans is partner, partner, partner. So with us receiving these grants, to start off with the telehealth for emergency services, involved in that grant is not only RCare, but Unity Health Systems, which is headquartered in Searcy in White County, and Padford EMS, which is a paramedic service that has provided our local paramedic services there for some time now in a rural county. White County and rural county are sisters. Only the river separates them. The hospital in Woodruff County closed in 1986, Then we shifted the patients over to Searcy and White County, so we have been dependent upon the paramedic services during that whole time. And there has been some financial strains involved in that, but we have stuck with them, and we do have a paramedic service. So how can we do that better? And that's through the telehealth initiative. Padford has bought into this, and and more importantly, is their paramedic personnel. And we also have another partner in Woodruff County Health Center, which is a long-term care facility. As you would expect, they do have a lot of ambulance runs. And so in a way, this grant will serve those two counties to raise our level of care into the telehealth age. And then the second grant, the HIV planning grant, I'm so proud that our care operates the HIV program for the whole state through the Ryan White program. But I would have to admit that the southeast part of Arkansas is the weaker part in terms of services. So partnering with their coalition of 14 hospitals throughout southeastern Arkansas, it will help us to shore up the services. And within the grant, there are a third of the patients who have HIV in southeast Arkansas are not receiving the care that they should. So with the partnership with the hospitals and with our care, we want to shore this up and take care of those patients. And that's the point of these two grants. And so I'm so thankful and appreciative. Thank you.
Thank you, and with that, Secretary Hargan will take any questions. Or will take any questions, I should say. Go ahead and say that.
Yep, sure.
On the residency programs,
Yep.
Can you talk about how many residents you expect to have in those programs?
So I think that they're going to concentrate, I think, at two a year, yeah, for that. Yeah, and 6 total. So that, and yeah, 3. Yeah, and so I think that's going to be pretty substantial. And, you know, to the point that residents generally, there's a greater adherence for them staying in the community, which, you know, somebody who has a background in rural health care, the important thing is to get them both to come into the community, to learn, you know, about the ins and outs of practicing, and then to stay there. And that you provide the support to them, and then they end up staying. And I think that's going to be the important part, what we hope to achieve.
How long are these grants for?
They're competed every 3 years, so some of them have a little bit different. The Rural HIV is a pilot program in this area, so that's for 1 year. We don't, you know, we're gonna come back to that. We'll compete it again next year when we see the results of the pilot that's coming out right now. The Rural Research Center is competed every 4 years, but they're generally 3-year.
And the HIV program, is that also going to be based out of Augusta, or?
I think so. Yep.
Well, our corporate headquarters happens to be in Augusta because that's where we started. Dr. Moore is our HIV director, and he's board certified in HIV. But his actual office is in Searcy. And presently, we cover the I would say the entire state, but Texarkana, Bentonville, Fort Smith, Hot Springs, Jonesboro, West Memphis, around the state, Texarkana, but there's sort of an open area there in southeast Arkansas. So, you know, now we have offices in Whitehall. Along with this and these partners, it will be throughout that area. So it's a lot of counties to cover. And that's one of the challenges that our care has in rural areas, is having good administrative people miles apart. So that's a good question, and so far our model is working. So.
With that, thank you very much today. Secretary, this is great news for Arkansas. I want to thank everyone who's participated in this, but more importantly, what you do every day for delivering quality health care throughout Arkansas. Thank you.